I must admit, I did think there would be pain after the operation. I was I thought, oh, if you're having that done, the pain must be going to be excessive. But it wasn't.
You don't want to be lying in bed all day. You need to be up and about, pottering and trying to get back on to being back to normal again.
When you are in bed, if you have a drain, this can simply be placed on the floor. The drain is a sealed unit and the fluid flows into the drain by a vacuum, so it doesn't matter if the drain falls over, and it doesn't matter where it is placed, as long as it isn't too far away from you to avoid it pulling and causing discomfort. You will be able to shower as normal after your operation. Your dressings are splash-proof, so should resist being sprayed with water. A very powerful shower could lift the edges of your dressing though, so the best way to shower is to direct the jet of water onto your back or away from the dressing. If you have a drain, then this can simply be placed on the floor of the shower, and the drain bottle can just be dried with a towel once you get out of the shower. After showering, simply pat the dressing dry with a towel. If you notice that any water has leaked underneath your dressing, then please contact your breast care nurse or the ward to arrange to collect a new dressing, as we would not wish you to leave a wet, soggy dressing in place. If you would prefer to use a bath, then please do not immerse your dressing under the level of the water, as this could cause water to leak under the surface of your dressing and allow the part of the dressing in contact with your wound to get wet. You will be able to return to most of your normal activities at home straight after your surgery. Do not do heavy housework or heavy lifting, but simple tasks like making a cup of coffee or making simple meals will be possible. Please do not restrict your arm movement and do continue to do activities in your home, for example, reaching into cupboards. Movements like this will be good for your arm mobility and will reduce the chance of you developing a frozen shoulder. We encourage you to do the arm exercises described in the leaflet and in our physiotherapy exercise video. In addition to these exercises, just using your arm normally to do your daily activities will supplement these exercises. You will find that you are quite comfortable following your surgery and will be able to return to normal activities quite quickly after your operation. You are likely to feel comfortable after your operation with only minimal pain, and normal painkillers like paracetamol and ibuprofen will be sufficient to control this. It is likely that you will need to take painkillers regularly to start off with, and then after some time, usually about a week, you may feel that you don't need to take painkillers as often. Make sure that you follow the instructions on the packets, and while you may need to take the maximum dose listed, make sure that you do not exceed this. You may feel you want to get outside in the fresh air after your operation. This is absolutely fine. If you have a drain, you can simply carry it with you in the bag provided or in a handbag. You can put the drain bag underneath a coat or jacket if you prefer it to be less visible. You may find you enjoy having friends to visit you at home after your operation. Many patients find it helpful being able to talk to friends and family about what they have gone through and about their treatment, or just to be able to chat about other things and get back to normal.